Close your lips, keep your teeth slightly apart, and make a low, steady humming sound for 10 seconds. Feel where it sits. Most people locate it in the throat, but if you pay attention, you will feel a buzzing radiate upward into the bones above your upper teeth, into the ridge between your eyebrows, into the floor of your skull behind your eyes. That buzzing is not a sensation. It is the surface of your face being shaken by a pressure wave you generated with your own larynx. And inside the cavities beneath that buzzing, something is changing right now in a way that is fully measurable by instruments and was first documented in a peer-reviewed paper in 2002. The question is what? Your vocal folds are two ribbons of muscle and mucosa stretched across your larynx roughly at the level where your Adam's apple sits. When air pushes through them at the right tension, they collide against each other between 80 and 250 times per second for an adult voice. Each collision produces a compression in the air above them. The compression travels upward as a longitudinal pressure wave. That is the physical definition of sound, not vibration in some loose sense. A longitudinal pressure wave is a region where air molecules are pushed slightly closer together, followed by a region where they are slightly farther apart, propagating outward at roughly 343 meters per second. When you hum at a typical male pitch of around 110 hertz, your vocal folds are slamming together 110 times every second and sending 110 compression peaks per second up through the column of air sitting in your throat. That column of air is the first thing you need to understand. Behind your nose, between your eyes, above your upper jaw, and inside the bone of your forehead, you carry four pairs of hollow chambers carved into your skull. Your maxillary sinuses sit beneath your cheekbones. Your frontal sinuses sit above your eyebrows. Your ethmoid sinuses sit between your eyes in a honeycomb of tiny cells. Your sphenoid sinuses sit deeper still, behind the bridge of your nose, almost at the center of your head. Each chamber is lined with a thin, moist mucosa, and each connects to your nasal passage through a narrow opening called an ostium, sometimes only 1 or 2 millimeters across. When you hum, the pressure wave traveling up your throat enters your nasal cavity and forces those small openings to act as resonant ports. The sinuses become Helmholtz resonators, named after the German physicist Hermann von Helmholtz, who described in 1860 how a sealed cavity connected to the outside by a narrow neck will amplify a specific frequency determined by the volume of the cavity and the geometry of the neck. Your skull is, in acoustic terms, an instrument, and humming plays it. Here is the number that should anchor everything else in your attention. In 2002, a research team led by Eddie Weitzberg and John Lundberg at the Karolinska Institute in Stockholm asked subjects to hum and measured the nitric oxide concentration in the air leaving their nostrils. Humming increased nasal nitric oxide output by a factor of 15 compared with quiet breathing. 15 times, not 15%, 15-fold. A single act of closing your lips and producing a low tone for a few seconds pushes nitric oxide release from your paranasal sinuses to 15 times the resting baseline. That 15-fold number is the line worth remembering because nitric oxide is not a vague wellness compound. It is a signaling molecule with a Nobel Prize attached to it. In 1998, the Nobel Prize in Physiology or Medicine went to Robert Furchgott, Louis Ignarro, and Ferid Murad for discovering that nitric oxide functions as a signaling molecule in the cardiovascular system. It is the molecule your endothelium, the thin single-cell layer lining the inside of every blood vessel in your body, releases to tell the smooth muscle in the vessel wall to relax. When nitric oxide diffuses into vascular smooth muscle, it activates an enzyme called guanylate cyclase, which raises cyclic GMP, which causes the muscle to slacken, which widens the vessel, which lowers the pressure inside it. This is exactly the mechanism that nitrate medications exploit. Nitroglycerin tablets dissolved under the tongue for angina work because they are metabolized into nitric oxide. The vasodilator class of cardiac drugs exists to push your vascular smooth muscle into the same state your humming pushes it toward. When you hum, your sinuses release a molecule that is pharmacologically identical to the active species of a prescription cardiovascular drug, in a quantity scaled to your own respiratory anatomy, at zero cost, with no prescription. That is not metaphor, it is the same chemistry. The molecular formula is one nitrogen atom bonded to one oxygen atom in either case. Now, before any of this nitric oxide reaches your bloodstream, it has to do something else first, and this is the second mechanism running in parallel during the same hum. Your sinuses are not sterile, they are colonized by a mixed microbial population, and the narrow ostia connecting them to your nasal cavity are exactly the choke point where bacterial overgrowth and biofilm formation become sinus infections. Nitric oxide is also a broad-spectrum antimicrobial. It is the molecule your macrophages use to kill engulfed pathogens. Concentrations in the parts per million range have been shown to inhibit bacterial and viral replication. The same gas that relaxes your blood vessels is, at sufficient local concentration, a sterilizing agent. By humming, you raise nitric oxide inside the sinus cavities to levels that suppress microbial proliferation on the mucosa where you are most vulnerable to chronic infection. A 2006 paper by Maniscalco and colleagues at the University of Naples extended the Karolinska finding by showing that the gas does not just appear, it ventilates. The pressure oscillations of humming drive air exchange through those millimeter-wide ostia that during quiet breathing barely move air at all. Your sinuses, in resting respiration, are stagnant pockets. Humming pumps them. The third mechanism is mechanical, and it is happening in the bone of your face. The pressure waves from your larynx do not stay in the air. They couple into the solid structures around them: your maxilla, your frontal bone, your ethmoid plate, your sphenoid. All of them are being driven at the frequency of your hum. This is bone conduction, the same physics that lets you hear your own voice from inside your skull, and the same physics exploited by certain hearing aids and underwater communication systems. The mucosal lining of every sinus is mechanically vibrated as the bones around it move. That vibration disrupts mucus stasis. Mucus that has been pooling, thickening, and providing substrate for bacterial colonization is shaken into motion and cleared through the ostia. Cilia, the microscopic hair cells lining your respiratory epithelium that normally beat at around 10 Hz to push mucus toward your throat, are augmented by an external mechanical stimulus that helps move material they would otherwise struggle to shift. The fourth mechanism reaches deeper, into your autonomic nervous system. Your vagus nerve is the 10th cranial nerve, a long branching pathway that descends from your medulla through your neck and into your chest and abdomen, where it innervates your heart, your lungs, your stomach, and most of your gut. It is the principal nerve of the parasympathetic branch, the part of your nervous system responsible for slowing your heart rate, lowering your blood pressure, and shifting you into rest and digest physiology. The vagus has both motor and sensory fibers in the larynx, the pharynx, and the soft palate, all of which are activated when you produce a sustained vocalization. Slow exhalation against the partial resistance of phonating vocal folds extends each breath cycle, lowering your respiratory rate. Lower respiratory rates increase heart rate variability, a measure of vagal tone, and higher heart rate variability is consistently associated with better cardiovascular and emotional regulation outcomes across population studies. The act of humming is, at the level of the nervous system, a mild, deliberate vagal maneuver performed by the same physical action that fills your sinuses with nitric oxide. Honest evidence calibration matters here. The 15-fold rise in nasal nitric oxide during humming is established. It has been replicated in multiple laboratories using standard chemiluminescence analyzers, the same instruments used in clinical pulmonary testing. The vasodilatory action of nitric oxide on vascular smooth muscle is biochemistry that won the Nobel Prize. The antimicrobial activity of nitric oxide in millimolar local concentrations is well documented in vitro and in animal models. Those mechanisms sit on the firmest evidentiary shelf. The claim that humming directly produces a measurable systemic blood pressure reduction in healthy individuals is physically plausible because the chemistry is correct, but the clinical trials testing humming as a hypertension intervention are small and short, and the effect size in non-hypertensive subjects is not clearly demonstrated. That shelf is plausible, but undermeasured. The claim that humming protects against viral respiratory infections by increasing nitric oxide enough to inhibit viral replication in your upper airway is, as of now, mechanistically reasonable and laboratory supported, but not yet established in randomized controlled trials at the population level. Treat it as a working hypothesis with biochemical backing rather than a proven clinical outcome. There is one further structural detail worth knowing. The geometry of your skull is not symmetric. Your sinus volumes differ between sides, sometimes substantially. CT studies have found maxillary sinus volume variation between left and right of 10 to 20% in many individuals. That asymmetry shifts the resonant frequencies of each cavity. When you hum at a single pitch, you are not exciting all four sinus pairs equally. Sliding your pitch slowly up and down across an octave sweeps the driving frequency through the resonant peaks of differently sized chambers, and the gas exchange efficiency varies across the sweep. The Karolinska measurements were done at fixed frequencies, but the physics predicts that a varying hum should ventilate more cavities more completely than a steady tone. This is a prediction the published literature has not yet fully tested in human subjects, and it sits on the speculative shelf, supported by acoustics, but not yet by clinical measurement. Now return to where this started. You closed your lips, kept your teeth slightly apart, and made a low, steady sound. While you were doing that, your vocal folds were colliding more than 100 times each second, sending pressure waves up your throat into resonant chambers carved into your skull, which amplified the wave at their natural frequencies, which drove gas exchange across millimeter-wide openings that during quiet breathing barely move at all, which lifted nitric oxide output to 15 times its resting value, which is the same molecule a cardiologist prescribes in tablet form to dilate the coronary arteries of patients with angina, which then ventilated your sinuses against bacterial colonization, while bone conduction shook stagnant mucus loose from the mucosa around it, while the slow, phonated exhalation engaged sensory branches of your vagus nerve and lowered your heart rate, all at once, from one sustained tone made with closed lips. The skull you carry is an acoustic instrument with chambers your anatomy already tuned. Hum tomorrow, not because it is calming, because it is chemistry.